Houston Vaccine Authority, Dr. Peter Hotez, now with Baylor College of Medicine. Thank you for your time, Dr. Hotez. We saw in Texas yesterday the single largest day increase in about 3 months since April 20th. So do you think a booster shot will be necessary, and when might we find out if we can get one?
Well, right now the most important thing to recognize is that we're still underachieving in terms of vaccinating in our area. The southern part of the U.S. has the lowest vaccination rates in the country. States like Louisiana, Mississippi have fewer than 15% of the adolescents vaccinated who are eligible, and only 30–40% of the young adults. Maybe a little bit better here in Harris County, but only about 45% of the county is fully vaccinated. So I think that's priority number one, is we still have to max out the number of adolescents and adults who get vaccinated, because that's how you start to slow virus transmission, not only to protect yourself, but actually protect the community. So that's big priority. One of the differences with this Delta variant, and it is much more highly transmissible than anything we've seen before. It's twice as contagious as the original lineage and 50% more than that UK variant. So what it means is that pretty much anyone who is unvaccinated is at high risk of getting COVID over the next few weeks. Now, in the past, we've known that vaccination not only stops symptomatic illness, but it actually halts virus shedding from your nose and mouth if you get infected. So it stops asymptomatic transmission. But it's not as clear that this is happening with the Delta variant, because the Delta variant seems to replicate at 1,000 times the rate of previous viruses that we've seen from that part of the COVID-19 family. So that's why we're having the discussion about the third immunization, for the possibility that this will help to actually stop transmission in vaccinated individuals who do develop asymptomatic infection. So I know that's a lot, but happy to unpack that a bit if you'd like.
No, it's information that we definitely wanted to know. Now, I wanted to see if I could get you to specifically address the Johnson & Johnson vaccine. We're hearing skepticism, especially from people who have gotten the shot and those who have not gotten it, who are worried about side effects. But how are you feeling about the efficacy as far as it is helping and fighting this new Delta variant?
Well, as far as we know, it's still working. And I say that because if you look at the hospitalized individuals or those who are losing their lives, they're still, 99.5% of the deaths are in unvaccinated individuals, and almost as many in terms of hospitalization. So if there are breakthrough cases, we're not seeing a lot of serious illness. The concern was generated by a preprint put up on something called bioRxiv by a group at New York University that didn't actually do efficacy testing, a clinical study, but actually did a laboratory study showing that those individuals who got a single dose of the JNJ vaccine, when they looked at their virus neutralizing antibodies, they looked pretty good against the original lineage, but against the Delta variant that went way down. And we saw that previously with the South African variant, and we know that the efficacy against the South African variant was down. So by extrapolation, we think it's likely that the efficacy may not be as high against the Delta variant. And that's the discussion about whether to give a second immunization booster. And if you looked at the old data from last year, those who got 2 doses of the J&J vaccine in phase 1, phase 2 trials got really good levels of virus neutralizing antibodies. So I always thought it was going to be a 2-dose vaccine, and that may be the case as well. And presumably FDA and CDC are meeting with the manufacturers of all 3 companies, Pfizer, BioNTech, Moderna, and J&J, and looking at what's warranted for boosters.
And Dr. Hotez, I'm just curious too, do we know the breakthrough infection rate among vaccinated people yet? Or do you think the CDC is doing a good job, tracking that kind of data for us right now, or are they way behind on it?
Yeah, this is the problem. So the CDC is tracking breakthrough hospitalizations, but as far as I know, they have not been tracking breakthrough infections. And that's something that a number of us have recommended to the CDC to really look into. So I think that that's part of the problem. So it requires investigators, like at the Texas Medical Center, to actually do an epidemiologic study of the vaccines in order to really know that number.
And Dr. Hotez, we've been asking our viewers all morning long how they feel about masks. 54% say nope, no matter what, I'm not doing it, while the other half says yes, I've either been doing it or I'm ready because I want to stay healthy. Now, we know it's a state's decision. We know our governor says he won't reinstate mandates. Can you talk more about how you feel about this? Obviously, our viewers are half and half on this. Always good to have an expert's opinion.
Yeah, and it depends what kind of setting. So, for instance, in the schools, right, because we're not doing a very good job of vaccinating adolescents and young adults, a little better in Houston than the rest of the South, but still overall not performing as well as we'd like. There's going to be a lot of Delta virus transmission in the schools. So, while we work hard to try to maximize vaccination of adolescents and adults, and we're not going to probably have the green light to vaccinate the little kids until the end of the year, we don't have a lot of other tools in our toolbox except for masks. So I think masks are going to be really important for the kids and faculty and staff of the schools in HISD and the surrounding districts for the next few months. In terms of what else you do, clearly if you're outdoors, I think we can, unless you're in a really crowded say an NRG stadium type setting outdoors, I think masks would not be so critical. But then you've got to make a decision about being indoors. Certainly if you're unvaccinated, you're much safer if you have a mask on. Even if you're vaccinated, given how much Delta virus transmission there is, it's not a bad idea to wear masks. So if I go indoors in a public place, I'm usually wearing masks, and when possible, then the question comes up about restaurants, and we'll have to see how that goes as Delta accelerates. So we're in a bit of uncharted territory here because this virus is just so contagious, and that's what's giving us pause for concern.
All right, Dr. Peter Hotez with Baylor College of Medicine. We appreciate your time as always. Come back and see us soon. Thank you.
Thanks so much.